Meet Lisa, just like any other loving pet, but with a unique set of needs. Lisa is one of the thousands of paralyzed dogs in need of special care and attention. According to recent studies, approximately 1 in every 500 dogs will experience some form of paralysis in their lifetime. Injury, illness, or congenital defects can all cause paralysis in dogs. Caring for a paralyzed dog may require more time and effort compared to caring for a normal dog, but the rewards can be great. With proper care and support, paralyzed dogs can continue to enjoy a good quality of life and form strong bonds with their caregivers. It's important for their owners to educate themselves about their pet's condition and to seek out resources and support from veterinarians, rehabilitation specialists, and other pet owners to help them provide the best possible care. Here is more information on providing proper medical care and treatment for a paralyzed dog. Regular veterinary checkups are necessary to monitor the dog's condition and adjust any medication or treatment. Maintaining good hygiene to prevent pressure sores, infections, and other complications, including cleaning and dressing any wounds or sores as directed by a veterinarian, regularly washing and drying the dog's paralyzed limbs will prevent skin irritation and infection. Keeping the dog's living area clean and dry and using a waterproof mattress or pad for added comfort and hygiene. Staying alert for signs of complications, such as fever, increased pain, or changes in bladder or bowel function, and contacting a veterinarian immediately if any are observed. Here's information on helping a paralyzed dog maintain mobility and muscle strength through physical therapy exercises. Start with passive range of motion exercises. With the help of a caregiver, these exercises involve gently moving the dog's limbs through their full range of motion to help maintain joint flexibility and prevent muscle stiffness. Gradually introduce weight-bearing exercises. As the dog's strength improves, you can start incorporating exercises that encourage weight-bearing, such as standing on a supportive surface or using a harness to help the dog stand and walk. Encourage activity and movement. Provide opportunities for the dog to move around as much as possible, either through assisted walking or using a cart or wheeled device. This will help maintain muscle tone and prevent pressure sores. Provide plenty of positive reinforcement. Physical therapy can be a challenging process for a paralyzed dog, so it's important to provide plenty of praise, treats, and other forms of positive reinforcement to keep the dog motivated and engaged. It's important to consult with a veterinarian and/or a veterinary physical therapist before starting any physical therapy exercises to ensure that you are using safe and appropriate techniques for your dog's specific condition. Creating a safe and comfortable living environment for a paralyzed dog involves making changes to the physical space to accommodate the dog's limited mobility. This includes installing ramps or elevators to help the dog move between different levels of the home, such as up and down stairs. Using non-slip flooring to prevent the dog from slipping and falling, especially in areas that may get wet, such as the bathroom. Providing soft and supportive bedding for the dog to rest and sleep on. Clearing the floor of any obstacles that the dog may bump into or get stuck on. In addition to making physical changes to the living environment, using assistive devices such as harnesses can also help a paralyzed dog move around more comfortably and safely. Harnesses can be used to help support the dog's weight and prevent falls, or to assist with mobility by providing traction or pulling power. When choosing an assistive device, it is important to consider the dog's size, weight, and individual needs to ensure that it is comfortable and safe for the dog to use. Here's some more detail on adapting daily care routines. Feeding. consider feeding the dog in an elevated position to reduce the strain on the neck and spine. You may also need to hand feed the dog if it has difficulty reaching its food bowl. Drinking. Providing a raised water bowl or offering water with a syringe or dropper can help the dog stay hydrated. Elimination. Using puppy pads or taking the dog outside on a regular schedule can help manage bathroom needs. Assisting the dog with a harness or sling may also be necessary. Grooming. Regular grooming is important for maintaining hygiene and preventing skin irritation. A dog brush, comb, or pet-safe grooming wipes can be used to groom the dog. Pay special attention to any pressure sores or skin folds, which may require cleaning and dressing. Exercise. Encouraging the dog to move, even if it is limited, can help maintain muscle strength and prevent bed sores. Range of motion exercises and gentle massages can also be beneficial. Remember to be patient and gentle with the dog. Diapering. If the dog is incontinent, you may need to use diapers to keep the living area clean and hygienic. These adaptations will help ensure that the paralyzed dog remains comfortable and well cared for despite its limited mobility. When it comes to managing a paralyzed dog's emotional and psychological well-being, it's important to provide a stable, supportive, and positive environment for the dog. Some specific ways to do this include: 1. Regular physical contact and affection, such as petting, cuddling, and massaging. 2. Providing plenty of positive reinforcement, such as treats, praise, and toys, will help the dog feel valued and appreciated. 3. Keeping the dog's routine and environment as stable and consistent as possible will reduce stress and anxiety. 4. Engaging the dog in interactive activities and games that are enjoyable and mentally stimulating. 5. Making sure the dog receives adequate mental and physical stimulation, such as walks, playtime, and training sessions. 6. Providing opportunities for the dog to engage with other dogs and people helps maintain social bonds and prevents feelings of isolation. By taking these steps, you can help your paralyzed dog maintain a high quality of life despite their physical limitations. A final thought on caring for a paralyzed dog is to approach it with compassion and a positive attitude. While it may require some adjustments and extra effort, providing proper care for a paralyzed dog can bring joy and fulfillment to both the pet and the caregiver. Remember to always put the dog's well-being first and to never give up hope, as with proper care, many paralyzed dogs are able to lead happy and healthy lives. In conclusion, paralyzed dogs are just as loving and deserving of care as any other pet. With the proper attention and support, they can lead happy and fulfilling lives. We encourage you to take action, whether it's volunteering at a local animal shelter, adopting a paralyzed dog, or simply spreading awareness about the topic.